Respected seniors and dear friends, today I am going to talk about basics of ultrasound. It is a very basic topic, but I hope it will be helpful to those who are started learning ultrasound for anesthesia and critical care practice. So why we need ultrasound? It is a real-time image guidance. Suppose if you are giving a block or inserting a central venous line, it will give you a real-time image guidance. It is an eye to an anesthetist for all his blind procedures. Previously, we were doing all our procedure blindly, but with ultrasound, now we can visualize and do the things. It reduces the pricks to locate now. As Shiv sir says, previously it was pock, 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 and with PNS. So you start poking the patient with needle, and suddenly you realize you get the twitches and you are excited. You are happy. But with ultrasound, you visualize the needle and then insert the needle. It can detect intravascular injection. It can help to prevent intraneural injection. It is very helpful in patient with altered anatomy. If you look at the supraclavicular area and interscalene area, you will find many alteration in anatomy. And if you ultrasound, you can give the block without creating any complication. It is studied that onset time, duration, guided technique. Regarding duration, we have observed that after starting ultrasound guided blocks, duration of the block is quite longer as when we compare it to previous blocks. When we talk, we need to discuss about basic physics, various props. We need to know about our machine, and we need to know how to visualize the needle in a better way. If we talk about basic physics, first of all, we need to know about piezoelectric effect. Piezoelectric effect is the conversion of the electrical energy to mechanical energy by ultrasound, by a piezoelectric crystal embedded in the ultrasound probe surface. They convert the electrical energy into the mechanical energy in the sound waves that get transmitted to the tissue. Then it reflected tissue either reflect the wave or and reflected wave will be converted from mechanical to electrical energy with piezoelectrical crystal, and you can visualize the picture on the ultrasound screen. We need to talk about acoustic impedance. Acoustic impedance is the resistance provided by tissue to ultrasound wave. Difference of acoustic impedance is important to generate ultrasound image. There will, as you go deeper, there will be a reduction in the ultrasound wave energy. That is called attenuation. So as you go deeper, image quality will be not as good as in the superficial structure. When you transmit the ultrasound wave on the tissue, some of the wave will be reflected back to ultrasound probe, some will be scattered, and some will be absorbed, and according to that, image will be formed. If you talk about nomenclature in ultrasound, you will find words like anechoic, hyperechoic, hypoechoic, isoechoic, or reflective. These are according to the echogenicity of the tissue. Echogenicity is the property of the tissue to reflect back the ultrasound wave. If the tissue is hyperechoic, it is reflecting back most ultrasound waves, and it will look bright white on the ultrasound screen. And if tissue like fluids or blood, that doesn't reflect any echoes, so it will look blacker on the ultrasound wave. So like that, nomenclature is the made. Here you can see hyperechoic. What is hyperechoic? When ultrasound wave is sent to the tissue, ultrasound wave will be reflected back to the ultrasound probe. So this will be hyperechoic and it will look bright white on the ultrasound screen. But when you are scanning on the tissue with fluids like vessels, artery or vein, what will happen? It will allow that it won't reflect any ultrasound wave, so it will look dark or blacker on the ultrasound uh, machine. So this is anechoic. If you look at the various structures, veins and arteries are anechoic, but veins are compressible and arteries are pulsatile. So by that you can differentiate it. Fat is hypoechoic with regular hyperechoic lines. Muscles are heterogeneous. It is mixture of hyperechoic lines within a hypoechoic tissue background. If you look at the tendons, they are mostly hyperechoic. So if you look at the peripheral nerves, they look like tendon. So you have to be particular. You need to know anatomy to differentiate tendon and nerves. Bones are hyperechoic with hypoechoic shadow. Surface of the bone is bright white. It is hyperechoic. But if you look beyond the bone, it will look darker black. So it is like a bright white echoic line, hyperechoic line, and then shadow, black shadow behind it. Nerves, if you look at the brachial plexus, initially at the level of interscalary or supraclavicular area, nerves are hypoechoic because there is more neural tissue than the connective tissue. But as you go towards periphery, nerves become hyperechoic because there is more connective tissue in this area. Acoustic impedance, as I said, air as the 0.004 acoustic impedance, while bone has maximum, that is 7.8. Tissue image is depends on the difference between the two tissues acoustic impedance. The importance of this thing is when you scan on the body, you need to apply some gel to remove the air between ultrasound probe and tissue. Otherwise there will be no image because of this air's acoustic impedance. If we talk about probe in anesthesia, we need mainly two probes that are curvilinear probe and linear probes. But for echo, you require separate probe. Curvilinear probe is a low frequency probe. It has got better penetration, so you can see deeper structure, but the resolution is not that good. But with linear probe, you can see superficial structure with better resolution. So linear probe is more used in most of our nerve blocks, while curvilinear probe is important in giving deeper blocks like sciatic block in the obese patient or lumbar plexus block, or some of our colleagues also use this curvilinear probe in the thoracic paravertebral probe, thoracic paravertebral block also. Here you can see as frequency decreases from 10 megahertz to 2.5 megahertz, ultrasound wave goes deeper. Uh, but with higher frequency, you can you cannot go deep, cannot see the deeper structures. So here again I repeat, curvilinear probe, better penetration, low resolution. It is used for abdominal imaging or deeper blocks. Linear probe, it has got it is from 6 to 14 megahertz. It has got lesser penetration but better resolution. It is useful for superficial structure like nerve blocks, vessels and lung ultrasound. Another important point is aspect marker. If you look on the ultrasound probe, this is sonocyte machine. Here this is the aspect marker. On GE machine, this is the aspect marker. What is the important? When you put your ultrasound probe, you should know from where your needle will come. Suppose if you are scanning for the median nerve, it lies medial to the artery, so you should go from medial side, so you should know from where your needle will come and you can search accordingly. If you look at this point, this is the aspect marker on the screen. This is available in Sonosite machine, but it is not available in GE machine. So you can confirm it by putting some gel and your finger to confirm what is medial and what is lateral. Here you can see I am putting my finger on the aspect marker side, and it is on the left side of the screen. So I know aspect marker is on this side of the screen. So how to select a probe? We should know what is the area of interest. Is it deep or superficial? And we should know about the size of the patient, and accordingly we should select the probe. Suppose area is deep and patient is obese, then we should use a curvilinear probe. And if we need to go superficial, then our linear probe, high frequency probe is good. USG image is a reflected signal gives in USG image reflected signal gives information about depth and nature of the tissue. If it reflectivity is high, like in bone, it looks white. If reflectivity is low, like muscle, it is gray. And if it is no reflectivity, air, it is black. Deeper structure on the lower portion of the display screen, and superficial on upper portion. That is very it is like a very common sense. Knobology. We should know our machine. There are certain important knob like preset, depth, gain, color Doppler, pulse wave Doppler. We will discuss it one by one. First, most important knob is preset. This is G machine and this is the preset knob. You can see it. Now, when you press the preset mode, you will find such various application like abdomen, or obstetric, gynec, cardiac, vascular, urology, pediatric, small muscle part, etc. You have to select one of it. For now block, we have to select SMP. When you select SMP, you will find other options like thyroid, breast, scrotal, small parts, musculoskeletal, nerve blocks, and joints. So we require mostly nerve block or musculoskeletal for our blocks like tap block and rectus sheath block. So we have to select these things for better visibility of nerves. These are the preset things on the machine, so you can have a better image of the nerves. Next important knob is depth. This is the depth knob. So when you want to see superficial structure, you have to keep the depth lower on the lower side. If you want to see deeper structure, you have to increase the depth. If you don't do it, there will be unnecessary loss of the space of the screen, and it is better to keep required depth in various block. Suppose I am scanning here for supraclavicular block. I put my probe here. Now I will see on the machine what is happening. Here you can see the depth is too much, so I will reduce the depth. Here you can see this is artery and this is the plexus, but I am reducing the depth so that I can visualize the needle very well. And I can see here pleura, and this is the rib. So this is what I need in the supraclavicular area. But suppose if I am giving sciatic block, I need more depth. Next important knob is gain. Here you can see this is a gain knob. This is for the brightness of the picture. We don't need too bright or too dark picture. We need to set it, and there is a function called auto depth. By clicking on the auto gain, you can have a better picture, but sometimes you need to adjust it. And this is the time gain compensation. It is for gain at the various part of the screen. Here you can see this is too dark image, this is too bright image. So we have to go for proper image. This is the proper image. So setting the gain is very important in ultrasound guided blocks. Next important thing is color flow or color Doppler. This is important to identify the artery and vein. artery and vein you can diagnose with by compressing with probe. By giving some pressure, you will come to know that is it artery or vein. Vein are easily collapsible, while arteries are not that easy to collapse it. For color Doppler, there is BART principle. That is blue is B is blue, A is away, R is red, and T is towards. So blue away, red towards. If flow of the blood is towards the probe, it will look red, and if it is away, it will look blue. So it is not like that. Artery is red and vein is blue. Here you can see this is carotid artery, which is looking blue, while this is vein that is looking red. So you should know about BART to while doing any arterial cannulation or central venous cannulation. And next knob is pulse wave Doppler. It is more important. By that you can know which is artery and which is vein. Here you can see I put my pulse wave Doppler on the artery, carotid artery, and it will show a arterial waveform. But when you put it on the vein, it will show waveform like this. So how to scan for a nerve block? Scanning is also very important. We should know the anatomy. Before starting any ultrasound guided block, you need to start reading anatomy books. Otherwise, you will fail. If you don't know anatomy, you can't give any ultrasound guided blocks, because you need to know what will you see. If you don't know, you can't see. And lens marks are also very important. It is not like that if you ultrasound you can do it where you want. You need to know landmarks. You have to put the probe on landmarks and then visualize the structure. Ergonomics, this is important. If you start doing like this, there will be a problem to your back. So it should be in your uh, vision, and you must be comfortable. Here is the way you should use it. You must be comfortable. Your machine should be in your eyesight, and you should not have to twist or tilt to give any block. So this is the right technique. When you can't see desired structure, apply part. This is important. Part is P is pressure, A is alignment, R is rotation, and T is tilt. This is very important to visualize any structure. P is pressure. Suppose patient is obese, if you apply pressure, it will compress the fatty tissue and you can see the desired structure. This is very important in tap blocks in obese patient. You have to align the probe to the structure, otherwise you won't see anything. So you have to do alignment to the structure. Rotate the probe. Suppose if you want to go from short axis to long axis view, then you have to rotate the probe. And by doing short axis to length, by rotating the probe, you will see the nerve or artery or vein in the from short axis to long axis. Tilting, this is very important. There is something called anisotropy. When you see femoral nerve or radial nerve or median nerve in the forearm, this is important. Sometimes what happens when you put your probe on the to scan the median nerve, what will happen? It will transmit the ultrasound signal and it will reflect it back away. So you have to tilt the probe to receive more signals. So tilt the probe and you will see the nerve from hypoechoic to hyperechoic, and this is very well seen in median nerves and femoral nerves. So this is what is tilting. Suppose you are looking at the nerve with this US probe first image, then what will you see? C5 and C6. Below is the bone. So if you change the direction of the probe and tilting of the probe, you will able to see C5, C6 and C7. Suppose your probe is here, you won't see C7. By tilting the probe, you will see the C5, C6, 7, or just go a little away from that and you will see all the structure. Visualization of the needle, this is very important. when you are giving ultrasound guided block. You have to see the needle all the time, needle tip all the time when you are giving the block. Otherwise you will end up giving intravascular injection, or you will injure some important structure like pleura in supraclavicular block. Why it is difficult? Because ultrasound image is a very thin image. When this linear probe sends the signal, this image will be 1 millimeter thick, so it is like a credit card thin image. So if your needle doesn't come below this ultrasound waveform, then needle won't get visualized. For this you require tilting and alignment and pressure and all that thing. You Another important point is you have to reduce the angle of the needle as much as possible to visualize it better. Suppose angle is more, then ultrasound wave will hit here and go away. Not all that wave will transmitted back to the ultrasound probe, so it will not look good. But if you reduce the angle, you will have a better image, and if it is if it is parallel to the probe, then it will be the best image. Healing maneuver, this is very important. Suppose if you can't see the needle, you have to do healing. Here you can see ultrasound probe, this is the needle, angle is more. So if you do healing, like pressing the heel, needle will be parallel to the probe and you can visualize the needle. This is what happens when you do healing maneuver. Suppose this is the needle and this is the probe. When you transmit the ultrasound waves, it will go away, reflected back away from the ultrasound probe, so you cannot see anything. But when you do the healing maneuver like this, what will happen? Ultrasound wave will hit the needle and get back to the ultrasound probe, so you will have a good image of the needle. So after learning all this thing, important thing is we have to learn hand-eye coordination. You have to, when you are giving ultrasound guided block, your eye is on the screen and you are maneuvering the needle on the patient's body. So you need to learn hand-eye coordination like laparoscopic surgeon does in laparoscopic surgery. We can practice with blue phantom, or you can prepare your own blue phantom which is very cheaper with paneer easily. We have to move either needle or transducer at a time. Don't move both at a time, otherwise you won't be able to see the needle tip. Don't inject if you can't see the needle tip. This is very important. If you can't see the needle tip, never inject the drug. So to conclude my talk, ultrasound marries the human hand to the digital age. It allows the examiners to interrogate anatomy and physiology with instantaneous visual gratuity. Ultrasound is eye to whole brain procedures by anesthesiologists. USG may appear complex at first sight but simply requires a change in thinking. Once the process has been learned, a step-by-step use will make it a routine and you will be expert in no time. Thank you all for your attention.